Hi, this is John from Trinity.
And Rick from Trinity.
So we want to talk to you about resources out in the community. If you have a patient that has had a heroin overdose and they're in your ER, they're with you. Almost every local law enforcement agency at this point is doing follow-ups. They have associations with mental health workers and outreach groups. The mentality of law enforcement has really changed over the years. They're trying to help the patient. They're trying to prevent that next overdose. So they're a huge resource for the family member. So if they reach out to their local law enforcement, they'll almost always have somebody assigned specifically to that community for this epidemic, and that really is a resource for the family members. There's also a great website. It's called drugfreegreaterlowell.org. About 90% of it would be consistent across the state, so it's got lists of shelters, of insurance agencies that can help you out with stuff, and detoxes and stuff like that. There's also a great organization that you could refer the parents or the family members of the patients to. It's called, Rick, what is the name?
It's called Learn to Cope.
Learn to Cope.
Yeah.
And that is a wonderful organization set up by a family member of someone who died of a heroin overdose. They do kind of meetings around the area where they talk about how it is and how you can support your family members as they go through this, whether they're still alive or even, unfortunately, if someone has died.
Yeah. And remember, as you're dealing with these patients that have recovered from an overdose, you have a very short window to be in front of them and to try to convince them to get some help. They're already starting to feel the symptoms of withdrawal, the nausea, the sweating, the abdominal cramping. So it's important that you take the opportunity to get in front of them before they leave your hospital and try to go manage their withdrawal symptoms and hopefully don't come back a second time again.